Here we are for the treatment of sexually transmitted diseases. First of all, what is STD, HIV, and AIDS, acronymed for STD or STI, means sexually transmitted disease or infection. HIV, as we all know, is human immunodeficiency virus, and AIDS is acquired immunodeficiency syndrome. Let's talk about the etiology and some prerequisites before going to the treatment. So, all in all, we have STDs transmittable most of the time, etiologically classified into those causing by bacteria, viruses, and others. And among those causing by bacteria, gonorrhea, which is a gram-negative coccus causing gonorrhea, and similarly, chlamydia trachomatis also is there, which causes chlamydia, lymphogranuloma venereum, and in the children that are being born by an infected mother with chlamydia, the baby might have Neisseria conjunctivitis during the birth process. And similarly, another bacteria, Treponema pallidum, causing syphilis, Haemophilus ducreyi, means the one causing sancoid, and it is very painful condition. And similarly, another bacteria is there known as Klebsiella or Calimactobacterium granulomatis, which causes granuloma inguinal, Donovania granulomatis, or Donovanosis. We'll see it later. Similarly, HIV and AIDS is caused by viruses. So are herpes simplex virus 2 causing genital herpes, and human papilloma virus causing wart in the genital region known as genital warts. These all are transmitted from one person to another by sexual contact or sexual intercourse. And regarding others, apart from viruses and bacteria, we have Trichomonas vaginalis and Thyrus pubis. Trichomonas vaginalis causes sorry. So we have this Trichomonas vaginalis causing trichomoniasis in females, and there are this pubic lice, also known as scientifically Thyrus pubis, causing lice in pubic region. In all, as a snapshot, there are more than 30 identified organisms causing sexually transmitted diseases. Among them, 8 are most common. 4 out of 8 are curable. And what are those common 4? All are of bacterial and protozoal origin, like syphilis, gonorrhea, and chlamydia, which forms the bulk, and sometimes trichomoniasis in female. And 4 infections are incurable to modifiable with treatment. That is human immunodeficiency virus (HIV), human papilloma virus, herpes simplex virus, and hepatitis B virus. So these are incurable but modifiable because they are viral origin. So first of all, talking about sexually transmitted diseases, talking about the transmission, STIs are infections that are spread primarily through person to person sexual contact. HIV and syphilis can also be transmitted from mother to child during pregnancy and childbirth, and through blood products and tissue transfer. The take home message from this line is that sexually transmitted diseases could potentially also be transmitted from other mode of transmission, that is vertical transmission from mother to baby, or during childbirth, and also the blood and blood products, as well as tissue transfer. STD is not transmitted via. What are the things through which sexually transmitted diseases are not transferred, not transmitted? That is, though in close contact, one may come in toilet seats, mosquito bites, sharing and eating in the same utensils, food, shaking hand, hugging, and donating, not receiving, donating blood are not transmittable. Prevention is the key. Abstain from sexual intercourse or only have a long term, mutually monogamous relationship with an uninfected partner. That is, have intercourse but with a reliable partner. And second one is male latex condoms and female condoms, if used correctly, that may also prevent from STDs and also from pregnancy. That is an added advantage. And male circumcision, which is practiced in the Catholic and certain Islam religion people. So this also reduces the risk of acquisition of HIV and Sancroid HPV or human papillomavirus, genital herpes simplex virus, and perhaps other STDs. Basically, they protect from these two important viral diseases: HIV and genital herpes simplex, genital warts. So the male circumcision is beneficial in this regard. And regarding vaccination is the latest development for human papillomavirus as well as hepatitis B virus, which is also transmitted through blood and blood products as well as unprotected sexual intercourse. And education and counseling is very important regarding prevention and detection of asymptomatic or symptomatic persons unlikely to seek evaluation forms the main measure of protecting a person from HIV AIDS and HIV AIDS as well as other STDs. This is a kind of seeking evaluation in the sexual workers, sex workers, and other who have multiple partners, and they practice unprotected sex. So in these cases, it is very important. This is the most important one. In the unlikely person to seek evaluation, like brothels, warehouse, etc. So this was a saying, I loved it. Only a poor boob, boob means an ignorant or foolish person, in slang. Only a poor person pays his money, loses his watch, gets the syphilis and brags that he had a good time. So it is um, against prostitution, which was very common in the past during war times. So that is it. Consequences and complications of STDs are very severe. That could be in male inflammation of testis, orchitis, epididymitis, and urethritis inflammation. In female, it might cause urethritis as well as cystitis, bacterial vaginosis, vulvitis, vulvovaginitis, mucopurulent cervicitis, acute pelvic inflammatory disease that may lead even to infertility, ectopic pregnancy. So, sorry once again. It could lead to ectopic pregnancy, stillbirth, congenital malformation, and other complications of pregnancy or puerperium during puerperium. So, in both, there may be ulcerative lesions of genita and genital and anal warts, intestinal infection like proctitis, proctitis, proctocolititis, enterocolitis, enteritis, and besides that, it may cause acute urethritis with urogenital infection or viremia, acute arthritis. This is also one possibility, and disseminated gonococcal infection, hepatitis, hepatocellular carcinoma, etc. So these hepatocellular carcinoma and hepatitis are called by hepatitis B virus. So STI को चाहिँ अहिले ट्रिटमेन्ट चाहिँ सिन्ड्रोमिक एप्रोच टु पेसेन्ट म्यानेजमेन्ट भन्छ, जहाँ चाहिँ काइन्ड अफ लिजन पत्ता लगाएर त्यो गर्न सक्ने खालको सबै अर्गानिजमलाई हुने खालको एन्टिबायोटिक दिने असल तरिका त्यस्तो छ. The most accurate method of diagnosing STI or STDs is by laboratory test, but it is unavailable in the most developing countries like Nepal, where relatively the disease is high, and because there is less amount of education and counseling and prevention. Therefore, a number of different organisms that cause STDs give rise to only a limited number of syndromes. A syndrome is simply a group of symptoms a patient complains about and the clinical signs you observe during examination. So, very finally, I'm saying we would like to find the kind of lesion and what are the possibilities and treat them all. Because of this, 1990 WHO has recommended a syndromic approach to diagnose and manage STDs. So, what are all the symptoms? The syndromes are as depicted. It is basically classified into 7 different types. For example, vaginal discharge, as you can see, vaginal discharge, and it may be this syndrome may manifest as unusual vaginal discharge, vaginal itching, dysuria, that is pain on urination, or dyspareunia, that is pain during sexual intercourse. And the signs, the doctor see it as abnormal vaginal discharge, and the most causative organisms, and the most the it is it may be due to vaginitis or cervicitis, and vaginitis is due to trichomonas and or candidiasis, and cervicitis may be due to gonorrhea and chlamydia. So we'll give drug to treat it all. So what are the treatment of gonorrhea? Gonorrhea is treated with ceftriaxone 250 mg 1 m once, intramuscular milligram intramuscular once, and the disease is finished. Or we can give orally cefodoxime, which is also third generation oral cephalosporin 400 mg per oral once, or cefixime, the same group drug, 400 mg per oral once, and the disease is done regarding gonorrhea. But we still have to treat chlamydia. Chlamydia is treated with azithromycin 1 gram per oral stat. So you give for chlamydia only once, or if you want to give it for longer course, then you can give doxycycline 100 mg BD for 7 days, and this is the treatment of chlamydia. And treatment for vaginal trichomoniasis may be single drug, single 2 gram oral dose of metronidazole, but the partner has also to be treated with the same dose of metronidazole. And another possibility of this discharge may be bulbovaginal candidiasis, in which we trust intravaginal administration of any of either miconazole or clotrimazole for 3 to 7 days. Or if we don't like to use the local one or topical one, we'll go for the systemic one with oral fluconazole, 1 tablet stat, and the disease is done. So all in all, we have just treated vaginal discharge, and vaginal discharge we have just treated, and with 4 different targeted for 4 different organisms. And this is more beneficial, and this may be kind of over treatment, but it has been educated suggested by WHO after so many studies. And next syndrome is urethral discharge, which may manifest as, yes, urethral discharge, dysuria, and frequent urination. Sign may be discharge from urethra. If necessary, the patient may milk the urethra, and the cause is gonorrhea and chlamydia, one of them, gonorrhea or chlamydia. And what we do treatment of gonorrhea and chlamydia as mentioned, as aforementioned. So this is it for gonorrhea. You give third generation cephalosporin, and for chlamydia you give the best drug would be azithromycin or doxycycline, as mentioned earlier. And the third one is something like this. That is genital ulcer. For genital ulcer, the symptom might be genital sore, dukhni, and on examination, the clinician will see, or the venerologist will see something like this. This is the genital ulcer, and this is treated with which is treated for syphilis, sancoid, and genital herpes. Syphilis and sancoid and genital herpes. These three all are different. These are not mentioned above previously. So what will we do for syphilis? For syphilis, we will give benzathine penicillin 2.4 million units intramuscular to the patient, to the recent within 3 months seronegative partner and all seropositive partners. This makes sense because it may take some time to appear seropositive. So all the patient, those seronegative who have been recently having sexual contact with that index case, will give them this drug also, the same drug benzathine penicillin 1.2 million unit on either buttock. So this is the way we gave the treat syphilis. And other possibility might be herpes, and it is not treatable but it is modifiable. So we modify it with acyclovir 200 mg 5 times for 5 days. So this is the dose of acyclovir, and other options are valacyclovir and famciclovir, which is not available in our part of the world till now. And for the possibility of Sanquid, we treat it with either ceftriaxone, azithromycin, or ciprofloxacin. The only new drug for us right now is ciprofloxacin, which comes in 500 mg per oral single dose. And also Sanquid orchid treatment is same like previously mentioned for gonorrhea. Ceftriaxone 250 mg intramuscular stat once and then done. And azithromycin we can give 1 gram per oral single dose. Mixed anaerobes might be the cause of lower abdominal pain syndrome, and it is patient will come with lower abdominal pain, and particular importance is dyspareunia. And the patient may, and doctor when he examines, he might see vaginal discharge plus lower abdominal tenderness on palpation, and temperature or fever is also there. Then the possibility of gonorrhea and chlamydia is there, as well as since there is a lower abdominal pain also, so it is not cervicitis in that case. I'm sorry, it is not vaginitis in that case. So trichomoniasis and candidiasis are ruled out. The only remaining, as it is vaginal discharge, could be gonorrhea and chlamydia. And there is also lower abdominal tenderness or pain and fever. These are much important. So we will treat for all these conditions in this lower abdominal pain with dyspareunia, which is pain during having sex, and this is treated with treatment for gonorrhea, chlamydia, and mixed anaerobes. Anaerobes drug of choice is oral metronidazole, 500 mg per oral BID. Usually we have 400 mg tablets, so we can overtreat it with 400 mg per oral thrice daily for 7 days, or metronidazole gel intravaginally once daily for 5 days, or clindamycin 2% cream vaginally each night for 7 days. That is also very good. So this is the treatment of anaerobes. Always when anaerobes come, remember two drugs. One is metronidazole and this is clindamycin. And if it is local or topical ones, it is more direct and it might work. And if the patient wants to take drug, or for some reason you want to take drug, we'll give metronidazole 400 mg per oral TID in our setup 7 days. So next is scrotal swelling. If the patient comes with scrotal swelling, we treat it in the same way as we treat vaginal discharge. Vaginal discharge in female is equivalent to scrotal swelling in male, but it is not cervicitis because male do not have cervix, so we'll treat only for gonorrhea and chlamydia. And similarly, there might be inguinal bubo, that is painful enlarged inguinal lymph nodes. These enlarged lymph nodes are seen by inguinal lymph nodes are seen by the doctor, and it also fluctuates, and it also may turn into abscess or fistula. So we'll treat for lymphogranuloma venereum and Sanquid. Treatment of Sanquid we have already mentioned. So we'll treat lymphogranuloma venereum as this is the inguinal bubo. As we can see, for fluctuating enlargement lymph nodes on the either side of the venous. So the treatment of lymphogranuloma benigna is doxycycline 100 mg BG for at least 21 days. It is a long-term treatment. Lymphogranuloma benigna inguinal bubo. And so this is a kind of revision as we see. For vaginal discharge, we give all four different drugs. For urethral discharge, it is not the patient has treated like vaginal discharge, but it is not due to organism causing vaginitis. It might be due to gonorrhea or chlamydia only. Similarly, genital ulcer. Uh, Here we added causes as syphilis, sancoid or genital herpes and treat them all. Lower abdominal pain will treat like gonorrhea and chlamydia plus anaerobes. With the name anaerobes, the two drugs come into our mind: metronidazole and clindamycin. Topical application being better than the oral. And scrotal swelling treated the same as vaginal discharge in male who doesn't have cervix, so no trichomonas and candidiasis. And inguinal bubo, we treat lymphogranuloma venereum as well as for sancoid and neonatal conjunctivitis. It is actually mothers being infected by the chlamydia most of the time, and during birth passes the neonate gets it, and it is treated in the same way as we treat gonorrhea and chlamydia. So important STDs not covered in the syndromic approach are granuloma inguinal or donovanosis, which is treated with a broad spectrum drugs like tetracycline, doxycycline, or azithromycin, erythromycin, trimethoprim, and sulfamethoxazole, also known as cotrimoxazole. And this is genital wart. And genital wart is treated with it caused by human papilloma virus, and it is treated with cryotherapy, that is coating with liquid nitrogen or podophyllene resin or trichloroacetic acid, bichloroacetic acid, electrocautery is quite famous, laser surgery, and surgical excision also if there is a big one. And human papilloma virus vaccine has also been available these days. This is genital or pubic lice. It is treated the it is treated with like other lice with permethrin, not 5%, 1%, unlike syphilis which is 5%. Similarly, we can give oral ivermectin, and we can also give malathion for that. HIV/AIDS. Lastly, let's talk about HIV/AIDS, which is also modifiable. It is not due to the actually we have not won the battle. We have not actually won the total battle against HIV/AIDS, but it has become largely non-frightening these days due to drugs, which was very good and can lengthen the life of patient, increasing the quality of life too. So HIV is a condition being infected with human immunodeficiency virus. Acquired immunodeficiency syndrome (AIDS) is defined in terms of either CD4 plus T cell below CD4 plus T cell below 200 cells per microliter, or HIV positive plus presence of any one of the following AIDS defining conditions. These are the AIDS defining condition. So if any patient has either CD4 count less than 200 or any one of these, it is classified as AIDS. And when to start drug in HIV is very critical. HIV infected patient will receive antiretroviral treatment in any one of the following conditions: when CD4 count is less than 350, not even you have to wait for 200. Development of any AIDS defining condition: HIV infected pregnant mother, HIV having nephropathy, and HIV with concurrent as hepatitis B or concurrent tuberculosis. What is antiretroviral do we have? It is we have reverse transcriptase inhibitors, protease inhibitors, and newer ones, integrase inhibitors and entry inhibitors. So let's see it. What are these? And first, we should know about these drugs. Nucleoside reverse transcriptase inhibitors are butene, like zidobutene, stabutene, etc. And similarly, nucleotide reverse transcriptase inhibitors are fovir, like cidofovir, adifovir, etc. And similarly, non-nucleoside reverse transcriptase are also drugs which are nevirapine, efavirenz, and dilaverdine. So these are the three ones which are non-nucleoside reverse transcriptase inhibitors. So all in all, we have these many protease inhibitors which has navir as the suffix, indinavir, saquinavir, ritonavir, etc. All the navirs. And how will you treat the patient once it is uh, okay to have the drug, like we defined earlier, with CD4 count less than 350, and all the age defining condition, or HIV nephropathy, or being pregnant mother, or or various other condition. We start with the first line, and that is NNRTI, non-nucleoside reverse transcriptase inhibitor, non-nucleoside reverse transcriptase plus 2 NRTIs. So this is the regimen we start. And sometimes due to the side effects, or due to various reason, development of resistance or whatever, if it does not work, then second line is NRTIs plus protease inhibitors. So this is it. Hmm. Thank you so much for your time.